Welcome back to another episode, Al. Throughout this episode, I'm going to discuss someone called Andrew Wakefield. To start, I'm just going to share a little event which occurred. Well, little is an understatement, but I quote 132 kids in California got the measles by either visiting Disneyland or being exposed to someone who'd been there. The virus then hopped the Canadian border, infecting more than 100 children in Quebec. An effective vaccine against it has been available for more than half a century, but many of the kids involved in the Disneyland outbreak had not been vaccinated because their parents were afraid of something allegedly even worse: autism. End of quote by Steve Silverman. The disaster that Steve Silverman mentions, the Disneyland outbreak, was caused by a former clinician called Andrew Wakefield. Andrew Wakefield was found to be fraudulent and caused this for fame and financial gain. When doctors or scientists are being quiet, it's time to hold them suspect, such as when Dr. He, the Chinese scientist, secretly editing embryos behind everyone's back with the motive to gain a reward, competing against Jennifer Doudna, who was awarded for CRISPR. Just like Dr. He caused a global outcry against editing embryos, Andrew Wakefield's actions caused an outcry to stop vaccinations with MMR. Andrew Wakefield associated the MMR vaccine with bowel diseases and autism, leading to the belief that vaccinations are the cause of autism. Personally, I find this theory ridiculous and hard to believe anyone believed him. We already knew autism is primarily genetic by this time. Through genetic and genomic research, we knew autism was among the human population hundreds of thousands of years ago, and we didn't have vaccines hundreds of thousands of years ago. These facts make me ask the question, when there were no vaccines, what was causing autism? Meaning it couldn't have been vaccines. Further question I asked, nearly all children were vaccinated with MMR for several generations already. So, since all of them were exposed to the cause of autism, wouldn't the majority who were vaccinated who were given autism diagnosis? Since approximately 1 to 2% of the world's population are assumed to be autistic, that's further evidence MMR is not the cause of autism. And we need to remember that correlation doesn't equal causation. Just to illustrate with an obvious example, all autistic people have a heart, for example. Does that mean that having a heart is the cause of autism? Obviously not. Some people get depressed when they look at, say, a giraffe. Does that mean giraffes are the cause of depression? I've never been depressed by a giraffe. There's an organization called Autism Speaks who made this much worse. The co-founders, Suzanne and Bob Wright of Autism Speaks, used this to fearmonger the world to believe autism is an epidemic child abducting disease. Andrew Wakefield had no evidence for his claim to begin with, so it wasn't even a legitimate hypothesis. His sample size was 12 alleged autistic children. That's a very small sample size to come to and to an objective conclusion. And some of the participants in the study were not even autistic. And his data was based on antidotes. 8 out of 12 parents reported their children begin exhibiting autism traits. But here's the important question. Were they actually autism traits? Can we be sure about that? There's a lot of psychiatrists like one called Dr. Bruce Perry, Dr. Alan Francis, Dr. Gerber Mater, who greatly criticised the DSM system by saying that it keeps our gaze just on external traits, what's happening on the outside. Yeah, and all humans perform these kind of autism traits, and they've all got hundreds of physiological roots. So, what's the evidence at a clinical diagnosis that the physiological root of these traits is autism? Dr. Bruce Perry said that if we just use these hollow descriptors altogether, we would just get garbage. And that appears to be what's happening, since the vast majority of humans are becoming worthy of being diagnosed with some psychiatric disorder. A journalist called Brian Deere was greatly researching and questioning all behind Andrew Wakefield's project, and the information he collected exposed the project as financial fraud. The paper of the project was published on the 28th of February 1998 and retracted on the 2nd of February 2010. Brian Deere spoke with some of the parents who believe that MMR caused their child's autism. Some objected to the published paper, saying the recorded data is not true. When they looked at the paper together, they could see the data was clearly distorted. Brian Deere writes, I quote, "My investigation of the MMR issue exposed the frauds behind Wakefield's research, triggering the longest ever UK General Medical Council fitness to practice hearing, and forcing the Lancet to retract the paper. Last May, it led to Wakefield and Walker Smith being struck off the medical register." End of quote. Before we move further, allow me to share something which made things even worse. Not only did Suzanne and Bob Wright, the co-founders of Autism Speaks, participate in anti-vaccine campaigns, celebrities in the public eye like Jim Carrey and Donald Trump were preaching anti-vaccine campaigns, with Andrew Wakefield in the UK spreading doubt on vaccines for fame and financial gain, and Jim Carrey and Donald Trump in the US. The anti-vaccine campaigns were on both sides of the Atlantic. Jim Carrey said, I quote, "Dr. Andrew Wakefield is being discredited to prevent an historic study from being published that for the first time looks at vaccinated versus unvaccinated primates and compares health outcomes with potentially devastating consequences for vaccine makers and public health officials." And further, there was someone called Andrew Buncombe, who works for a newspaper article called The Independent. On the 5th of May 2018, he wrote, I quote, "On more than 20 occasions, Mr. Trump has tweeted about there being a link between vaccines and autism, something experts at the government's leading public health institutes say is not true. He also repeated the claim during a Republican primary debate, a remark that was immediately dismissed as false by the Autistic Self-Advocacy Network." Close quote. When I talk about things like capitalism to do with autism, there is someone called Professor Alicia A. Broderick, a disability scholar, who produced a book called The Autism Industrial Complex, where she shares a great deal of research about a decade's worth, showing of how autism has changed and so on throughout the last 75 years, all the history of it. And here's what Professor Alicia Broderick found out. I quote, "Professor Broderick's research involved in what Donald Trump did during his time as president. I quote, more recently, in 2019, President Trump signed into law the Autism Collaboration, Accountability, Research, Education and Support Act, aka the Autism Cares Act, a reauthorization of the Autism Cares Act of 2014, itself a reauthorization and renaming the Combating Autism Act of 2006, which allocates $1.8 billion across fiscal years 2020 to 2024. The reauthorization law now requires the National Institutes of Health to fund research into developmental, behavioral, and clinical psychology, in addition to its extant mandate to fund research into the neurobiology, genetics, and genomics of autism, thus feeding and subsidizing both intervention and prevention industries with federal funding. End of quote. Andrew Wakefield's project was deception. The published paper contained intentional lies, so he could have the data that he wanted. Before he even did the project, he had a vaccine of his own making, but he wouldn't be able to sell it as long as MMR was still in use. Wakefield kept claiming it's better to take the vaccine separately so he could replace the MMR he said causes autism. Other professionals, as well as Brian Deere, the journalist, were strongly questioning him. They wanted greater evidence of his claims. This brought Wakefield a problem. He required autistic volunteers as participants in order to participate in a study. He gained volunteers, but he harmed these autistic children in the process. Andrew Wakefield failed to inform volunteers of all side effects and potential dangers of participating in the project. The other doctors and nurses in the study saw it as unethical that Andrew Wakefield was causing physical restraint on the children, but informed consent includes the right to withdraw, and he kept them all in pain, sticking things up the bottom into the small intestine, withdrawing blood. Even when they wanted to withdraw, he wouldn't allow them, and that was abuse. Brian Deere, with his documentary, exposed the financial conflict of interest, both on the television news and in a documentary he's made, which is available here on YouTube. Once Wakefield was exposed, he left the UK and immigrated to Florida to continue living by his lies, running anti-vaccine campaigns. But anti-vaccine campaigners pay Andrew Wakefield, still to this day, by purchasing his products, his fake cures to autism. Wakefield even discouraged people from taking the vaccine for COVID-19, for the pandemic that we've just experienced recently. What I can say to all of you is, just as numerous people say from the Autistic Self-Advocacy Network, doctors themselves, those who have done autism research, vaccines do not cause autism. And the simple questions I just asked, like, what was causing autism hundreds of thousands of years ago when there were no vaccines? If the vast majority of the world are exposed to the cause of autism, why aren't the majority developing autism? So I would say it's pretty easy to give away that vaccines do not cause autism. Please may subscribe to the channel and help spread the message so that more people will be willing to give their children relevant vaccinations to protect them from illnesses and other diseases such as HIV, smallpox, and any other illnesses that spread. Please help protect the children. Don't keep these myths going around about vaccines being the cause of autism, all because of Andrew Wakefield. Thank you for listening.